So one of the questions I get asked often is, how do I get into orthopedic surgery? It can be from pre-meds to medical students or even younger. What steps do I take to become an orthopedic surgeon? I became an orthopedic surgeon in 2011 when I finished my residency. I did a fellowship in around 2011 to 2012 in hand surgery and upper extremity surgery. So I have been through the process. I have interviewed pre-med students, medical students, and even residents, and even interviewed people to potentially join a practice. So I've been through all the stages of the process to go from pre-med to medical student to resident to fellow to attending doctor, and not only gone through it myself, but also interviewed people going through it more recently. So I can tell you from having done all these different interview processes throughout the years, especially for orthopedics, the number one thing that tends to get looked for amongst admissions committees is a hard worker. Sometimes people will think, oh, if I get the highest board scores or the highest grades, I'll be super attractive to any orthopedic surgery residency. To an extent, you might if it's a heavy research-oriented place where they want very high numbers, not only of board scores, which I don't even know if they quantify them anymore. I think it's just pass-fail now for the most part. But if it's a place that really wants a lot of academicians that potentially will write a lot of publications, and that's another thing they would look for in residency is a lot of publications. But by and large, the number one thing you can do to get in the pathway to becoming an orthopedic surgeon, at least from a standpoint of matching into a residency, which is sort of when it starts, is to show that you're a hard worker, and you should be a hard worker. It is a manual job. There is a lot of mental component to it, obviously, but it is a demanding job, manually and mentally. You need to be a hard worker. It's a difficult residency in the spectrum of residencies. All residencies are difficult, but you are in the hospital a lot. I was in the hospital for basically 5 years, it felt like, in residency. It's a 5-year program. You do 1 year where you do a little bit of general surgery and a little bit of orthopedics. At least that's how my program was. And then 4 years of just orthopedics. And you put a lot into those 5 years. You won't see your family all that much. It's gotten a little better now, but we only had, I think, 2 weeks vacation total each year. And, a lot of times you're so tired, you spend that time just resting, at least some days at home. You'll miss, events that you want to go to. You'll be on call for, Christmas or New Year's or Thanksgiving several times. So it is demanding. And programs want someone who's a hard worker and who's going to show up for work and going to be able to get the job done, because you might get 30 or 40 consults in a single day when you're the consult resident. That happened to me often. You might be up all night twice in the same week just on regular call. You might be on call from home and have to come in multiple times. It is a very rewarding specialty. I had a great experience overall in residency and training, and I'm very thankful for what I'm able to do now as a result to help my patients. But it is a residency that you really have to put a lot of hard work in. And they all require a lot of hard work, but orthopedics seems to be close to, if not one of the, orthopedics is probably considered one of the hardest residencies there is from a workload standpoint. And so you definitely want to demonstrate that when you're interviewing. And one of the ways you can do that is through your grades. People want to see that you've put in work in the classroom. If you are a pre-med student, one of the things they're going to look for in medical school admissions is your science GPA. They want to see, did you work hard in organic chemistry? Did you work hard in your prerequisite classes? Even things like calculus and the other things that they use to calculate that science GPA. They want to see that you're a hard worker. So that's key. Um, Aside from hard worker, the number two thing they'll look for is aptitude. You have to demonstrate a certain aptitude, uh, and that's kind of where standardized test scores come in. That's where, if you're applying to med school, the MCAT comes in. Med schools want to see that you're going to be able to pass the USMLE steps, that you're going to be able to get uh, your board certification once you're completed your residency. They want to see that you're able to take tests. You don't have to be the top test taker in the world, but you need to demonstrate that you're going to be able to pass the test, so that you can keep progressing, because they want their doctors, med schools want their doctors to go on and do things in the field and become leaders in the field. So if I had to pick number one, hard worker, number two, aptitude, and then the third part, and I call this the hat trick, T, the ability to work well with others. That is really key for orthopedics. It's key for any specialty, but especially for orthopedics, there's a lot of camaraderie that goes on amongst the residents, and the ability to work well with others is extremely important. If you're a great candidate on paper in terms of great grades and great board scores, and there's some sense that during the interview process, the admissions committee for residency thinks that you may not get along well with others, if that's kind of the hint, and sometimes that'll be noticeable if you did an away rotation at a facility. An away rotation is another thing you can do to help gain admission, especially if they like you. It's basically like a month-long interview. So that is a key thing as well. The ability to work well with others. There's things you can do to help demonstrate that. I honestly think that if you have a history of playing a team sport or doing something with a team or with a group as part of your background, which you'll talk about at the interview, that can really help. Because a lot of times in residency, there are little things that you'll have to ask a co-resident to help you with, or they'll need to pick up something that a patient that you saw on call, and then you are off call, and then they have to take care of it, and then you have to take care of it later. It's a lot of helping each other out. And if you have a resident that doesn't get along with a lot of the other residents, it can be a real problem for the whole program. And they'll try to, and at least in the interview process, look for people that they think are going to be easy to work with. You spend a lot of time with your attendings and co-residents in residency, definitely more time than with your loved ones and significant others and spouses. So, that is a key component to it. So make sure that, you, first of all, do work well with others, and that you demonstrate that through your background, or through doing an away rotation where they can see it up front, that you are able to help your colleagues and do a good job yourself. So that is the hat trick. Hard worker, aptitude, and the ability to work well with others. Those three components are the three most important components, at least in my mind, to getting into an orthopedic surgery residency and being successful as an orthopedic surgeon.